Hello, good morning, and good afternoon. This is Kristen DeProspero from Solutionz. We're happy you're here with us today. We're going to give people a little bit of extra time to get in here, but to go over some of the logistics, we are going to have an open discussion and hopefully be able to answer your questions and share some insights that we have about this tribal funding coming out from the NTIA, first time, brand new funding source. We are going to give you our perspective and point of view and help you review the idea of applying for this application and help you understand both the technical side of this application as well as the use cases and explore ideas on how you may use these funding sources or this funding source for your projects in your tribal organization. Again, my name is Kristen DeProspero. I'm the Vice President of Grant and Adoption Services at Solutionz. And let me pass it over to Andrew to give his introduction.
Hi, everybody. My name is Andrew Henshaw. I'm the Director of Business Development and Operations for Learn, Design, Apply. We're a grant management and consulting firm specializing in achieving federal, state, and local, and now stimulus funding for underserved communities and applicants.
And we're so grateful to be joining you here together. Both of our organizations specialize in what I always refer to as grant advocacy. So our first and number one goal in our day-to-day lives is to make sure that people understand that these grants are available, particularly organizations that are really eligible for these funding sources. So we do a tremendous amount of outreach to get the word out. That's our number one goal. We want you to know about these funding sources because you're highly eligible. And sometimes it's just not easy to find this information or become aware of it. So that's our number one goal. Secondarily, we like to add our support to your efforts. So both Andrew's organization, my organization, we work hand in hand. We work together to help walk you through what it's going to take to submit a successful application for this and any other funding source that's appropriate to your organization. So we really appreciate you taking the time to join us today. We're going to start with a little bit of a technical overview. Some of you may have witnessed and watched the NTIA webinars that are already available on this program. We're going to really kind of high level net out what's going on in this program. So I'm going to pass it to Andrew to do that, but I want to encourage all of you to type in the chat if you have questions as we're going. We want to try to make this interactive and informative for you specifically. So feel free to openly ask any questions that you have. No question is unwelcome or inappropriate. Ask anything you like, and we will stop to answer those questions. So take it away, Andrew.
Thank you, Kristen. Well, I think I might like to start out first to see if we can get some interaction here, just to make sure people start feeling comfortable with the chat window. I just want to see, if there are any individuals here that haven't attended an NTIA webinar for this funding, or possibly this may be the first time that they're seeing this funding opportunity mentioned. Is there anyone out there on this call that may be interacting with this opportunity for the first time? Give you like 10 seconds or so. Okay.
And I think, Andrew, just to kind of talk about that too, they do have a good number of webinars that have been recorded that you can listen to. Some of them are pretty lengthy, but I understand that a lot of the different Q&A sections of each of those webinars have been really helpful. And we're going to try to synthesize a lot of what we've heard into this discussion today to help answer some of those questions.
Sure. Yeah, and so, we can just go over the high level details again. just the total funding amount available for this program for NTIA tribal broadband is 980 million. That's a fairly unprecedented level of funding, especially for tribes in specific. And of particular note here, every tribe that submits an application, so long as it's completed, it receives $500,000, regardless of whether or not their full project is funded. It's a bit of a consolation prize of $500,000, which is kind of up at the higher limit of most grant programs outside of this. It's kind of a unique and novel opportunity to receive some funding, again, as a bit of a consolation prize. So the learning there is that, regardless of whether or not you get you're confident that you have a full infrastructure project ready to go or a broadband and adoption and use project ready to go, it's still worthwhile to apply. Just because you can receive some additional funding, you could potentially use that for broadband efforts related to engineering studies, feasibility studies, marketing efforts, and so on. So I think it's a really good idea to maintain interest in this and continue to move forward with the project, and we can certainly assist with that if needed. Going into the higher level details of the infrastructure funding, you have anywhere from 1 to 50 million as a suggested range. You can certainly ask for less or more, but they're kind of suggesting those thresholds. And again, this is an unprecedented amount of funding available per applicant. Even the larger broadband infrastructure programs offered through USDA have a cap of 25 million for grant funds. So this is a huge opportunity for tribes. And then,
Andrew, could you clarify? Is it your understanding that they can apply for either, or they don't have to apply for both, or they aren't required to apply for the infrastructure in order to go beyond that?
I believe they can apply for one or both. Adam Geisler, who's the program director for this, has basically said they're looking for the ability to look at each of these applications as unique requests. And so they want to just see what the needs are and determine and evaluate what sort of funding may be needed. That being said, if you're not going to be requesting the infrastructure funds and looking really just for the adoption and use funds, you should probably demonstrate that your area is effectively served already with broadband services, and then demonstrate again that need for the use, adoption, and other equipment and technology that can kind of bolt on to that already developed infrastructure. So it's again very specific to the needs of your tribe, and you just want to make sure that you're telling the full story and that it makes sense and lines up. So you're not requesting $2.5 million for a bunch of distance learning equipment if you don't have the effective infrastructure to actually use it. So hopefully that answers your question there.
It does. Thank you.
With a due date of September 1st, I know that may be a bit intimidating. Again, for first-time applicants, this is a totally new program that has been created, but it does have a similar overlap to a lot of other distance learning and telehealth programs. If anyone here has done a DLT application through USDA, that stands for Distance Learning and Telemedicine, there are a lot of overlaps in the narrative. Chances are, if you have a grant writer on staff for your tribe, and you've done any sort of grant application, there will be some significant overlap in describing the community, the need, the issues that you encounter. The only thing that's really going to be massively novel is the broadband infrastructure piece. If you've never done a broadband grant before, again, we can provide assistance on that, talk you through kind of the perspective that we would choose to approach it with, provide frameworks, but that's going to be really the only novel area that you're going to be needing to describe here. Looking over at the eligibility requirements, you want to either be a federally recognized tribe or an organization within a federally recognized tribe. So the federally recognized tribe would have to deem your organization as a tribal organization as the sole applicant for that federally recognized tribe. And then you can just kind of read through the list here. Won't go into a whole lot of additional detail on that. And then looking back at the eligible adoption use of funds, you're looking at the classic distance learning, telehealth, education, healthcare, workforce, and I think to top it all off, really just kind of broadband adoption activities, which could mean people gaining access to the internet for the first time are going to have issues with learning kind of web search, how to Google things. Everything from again, just kind of general web search over to maybe more of like the Microsoft Office, workforce uses, developing an e-commerce website, and you can kind of stratify that to beginner, intermediate, and advanced level courses, that you can develop for this. And I think one thing that's missing here, I forgot to add it on, is that you can actually use a portion of these funds for broadband subsidies for low-income individuals on the tribe land. So you can set aside a portion of these funds really just to fund for a year of service for any, again, any resident of the tribe that may need assistance with affording broadband service. So I just developed a slide here indicating, why this funding is truly unique. I think the first is that it's 0% match. So there's absolutely no financial commitment from the tribes to apply for this funds. Typically we see grant applications anywhere from 15 to 50% match requirement, which means you're, at 50%, you're doing dollar for dollar match for federal funds. This has 0% match requirement. So you can really kind of ask for whatever you want or need. And again, you don't have to provide any tribal funds as match. So it's very worthwhile to at least submit an application, just because there is really no financial risk there. Again, with the financial maximum award here, you're looking at $50 million, which is, again, unprecedented. And as far as I can tell, largest maximum award in recent history. There's $1 billion specifically for tribes, and that's a huge sum of money. We're talking about USDA Reconnect program having traditionally about 550 million nationwide for general population, all applications of any type of organizational entity. And now we have $1 billion specifically for tribes. This is, again, a great opportunity to ask for what you need, and it kind of protects that funding, specifically for tribes. The funding is comprehensive, so you're looking at an approach for infrastructure and whatever you need on top of that. So, I guess the analogy that I've heard that I like best is, they're funding the highways, but they're also funding the cars. They're also funding the licensing for those cars. They're funding really everything you need to create an ecosystem and a working infrastructure to improve the use of distance learning technologies, to improve education, healthcare, to improve workforce opportunities, to stay socially distanced if needed, and other digital equity initiatives to kind of bring communities into I guess parity with more urban areas.
And if I could add something here, Andrew, I love the cars on the highway analogy. It also will fund consulting and training and support that you might need, either for managing your IT needs or learning how to implement and operate a distance learning program or telemedicine program. So it's very all-encompassing, meaning, covering everything from soup to nuts, A to Z, cradle to grave, everything that you can think of inside of trying to accomplish that. So if in your minds you're thinking, oh boy, we don't have the resources, we don't have the people, we don't know how to do this, or we've never done it before, understand that all of that can be answered with this funding by either insourcing or outsourcing consulting and other resources that you need to help you, manage those hurdles as you're growing and adding this capability to your community.
Mm-hmm. Very much agree there. Final point to close out this slide. Again, I've never heard of an application from the federal government that gives you this consolation prize of $500,000 if you aren't awarded for your request. It's my personal opinion. I don't think I speak on behalf of Kristen or anyone else here, but I think you'd be crazy if you didn't apply for this and at least give it a small effort to try to get something thrown into grants.gov for this, because it really just passing up $500,000 to me seems like a very huge missed opportunity.
Yeah, and I'm going to go a little deeper on that and just repeat what you're saying here. If you submit the paperwork, if you submit the application, even if you don't feel like the application and what you've put into the documents makes sense or is accurate, or you might have missed something. If it gets rejected, you still get that 500,000. So I guess our number one, we want to make sure everyone's aware of it. Number two, encourage you to submit your application because you're going to automatically get the $500,000. So that's really the messaging here. Make sure you don't pass this over because it's either feels intimidating or confusing, or you've never done it before. And by the way, this may be a very good time for me to pipe in and say that we're developing some templates and some tips and details to help walk you through how to submit this step by step. So hopefully that will help as well.
So moving on to the next slide, actually, I'll take an opportunity here. Are there any questions? If people want to, again, just use their chat window there, see if they can type in any additional questions you might have. No issue with asking something that may be answered in a later slide. We'll try to answer it as you guys are thinking of these questions. So feel free to start throwing those in there. And Kristen, if I end up somehow ignoring the chat while I'm presenting, just please keep an eye on that so I can make sure to answer these things as we go.
Absolutely. We do have one comment that one of the people, Mark Detrick, is saying that this is their first time in an NTI meeting, having this discussion. So we encourage, we're certainly going to cover what we've learned and what we know. And I also encourage you to look at some of the recorded sessions from the NTIA itself, and we'll provide details on that as we go.
Great. So looking at the important considerations, and this is just reading through, with a fine-tooth comb, the NTIA tribal broadband guidance, the guidelines that essentially tell you how to apply and to maximize your score for the application. So looking at the timing, 12 months is not a long time. I think that there are several factors included in that. If you live in a colder environment, let's say you're a tribe in Alaska, you may only have 3 to 4 months to complete a project as opposed to the full 12. If you're building something underground, you have to think about the timing for which you can complete the work and all of the other activities that can be done, while the weather, may be too, I guess, detrimental in terms of progress for outside work. So making sure that you fit within the 12 months, look at something that's reasonable. You probably shouldn't go for a full fiber to the home project for 700 square miles if you don't feel like you have a wealth of contracted work that can be done over the course of 12 months to get it completed. So just look for reasonable approaches, and of course with the broadband adoption part in mind, there can be large capital expenditures for laptops, tablets, distance learning modules for classrooms, telehealth carts. All of that stuff can be a one-time capital expense, and that can certainly be completed within 12 months. And then, again, just kind of referencing back to the infrastructure. There are a couple of different approaches there, which, we can go into additional detail if you would like. Please chat if you want to do so. But, there are several different models that you can approach, one being pure fixed wireless. You can go full fiber to the home. It really just depends on the size of your community that you wish to serve and the ability to complete that work over the 12 months. Looking at the speeds that they wish to see, I did notice here that there's only a 3-point difference between serving a household with 5010 download/upload speeds versus the full gigabit fiber speeds. So it seems like speed, you're really just trying to get above that 25.3 threshold for download and upload speeds, and that's considered kind of their minimum to be considered served. There's really kind of a minimum consideration for speeds as long as you get above that threshold. So you don't have to really focus on getting to that gigabit speed in order to maximize points. It's really a non-factor once you achieve kind of that minimally feasible scoring there. Looking at the scoring metrics, you're looking at effectively a C- for your grant score. They're not really, it doesn't appear that they're judged against one another. You're looking to just achieve this minimum score of 70 points out of 100. And again, you're looking at 45 points here for digital equity, where you're explaining how the project, both infrastructure and the adoption use, will be looking to promote adoption and uses of telehealth, remote learning, telework, all of the things that you would need to stimulate the economy, boost education, improve health metrics, and so on. So really, you're kind of duplicating the effort here in a really good way. Almost half your score is looking at thinking about all the ways in which you need to improve your community. So you can almost practice this as like a journaling exercise of thinking about all of the different issues that your community is encountering, list them out, and you can kind of use these high-level subjects, like telehealth, remote learning, telework, and then just write several sentences underneath explaining, what the interactions are in your community, what you might need to improve those, and there's 45 points right there. If you explain it well and it makes sense to the evaluator, you're looking at half your score out of the 100 points possible, just in that broadband use, adoption, and demonstration of need category.
And this is a place where we can really help you. This is something that we deal with day in and day out, year after year. Both Andrew and I and our organizations work in this space of telehealth, remote learning, telework, all of these areas that require broadband. So we can really help you explore that. And that's what I encourage each of you to do. We can schedule a one-on-one discussion and brainstorming session to just talk about what are your circumstances, what do you currently have, and then we can talk about what you can do, all the possibilities of ways to use and adopt broadband throughout the community that is helpful and serves exactly what you want to do. So one of the ways we do that is we'll talk about what's going on. What are some of your issues? Do you have substance use and abuse issues? Do you have learning loss issues? Do you have general health care, and behavioral health and mental health challenges because you don't have enough providers to help provide those services to you? So we'll talk a little bit more about telehealth and distance learning in a little bit, but the message I'm trying to get across is that we can be a sounding board for you and talk through and brainstorm about how you might want that to look and help you think outside the box, because this program, the program manager, Adam, and this program have been saying over and over and over and over that they want you to have what you need. It's not prescriptive where they're saying you should have this or we think that you need that. They really want to hear from the tribes what you need, what are your top priorities, and get creative there, because that's what they're trying to fund. So again, this is just a super unique program where they're not being very prescriptive and saying you have to buy this XYZ thing for this amount of money to do this purpose. They want to hear what your biggest needs and challenges are and how broadband and broadband adoption can help those.
So I'll build off of that, actually. I think that's a great point you're making. Maybe two areas of focus for us in terms of publicly available information. Greatschools.org is a really good spot to look at the performance of your schools and to have those objective metrics for which you can start writing your narrative. So typically when I do research for a community, I go to greatschools.org, look at all of the schools within the region, let's say for a county school district, and you can look at the progression of rating from 0 to 10, 0 obviously being the worst, 10 being the best, and see, if you're falling underneath the 5 mark, you can then look into standardized testing scores, where if you see that you're ranked low in English or math or sciences, you can start writing about that. Why may that be? Do you have a shortage of teachers? Do you have a shortage of available, outside of the classroom curriculum that helps develop that understanding in a real world context? Looking at, I'm trying to think of the standardized testing scores for like AP testing. Maybe your community is so rural that you just don't have access to the appropriate training, the prep courses and stuff like that. Maybe they're unaffordable. Maybe that can be a part of your broadband use and adoption program. If you can access training like that online, as opposed to needing to travel an hour or two to get to an in-person training course, that's going to significantly help out your students in achieving, the participation in AP testing, potentially getting dual enrollment credits for community college, and eventually obtaining a degree. All of those things can kind of stem from that initial research on greatschools.org, where you can at least get the objective metrics and start working on the why as to why those scores might be lower than you would like. Looking at the healthcare side of things, I always look at the community health needs assessment of the county, and you can just look that up in terms of where the, I guess, the greatest population for your tribe is going to be located in a county, or they might do multiple county community health needs assessments, and they will provide an executive summary and probably an additional 10 to 15 pages of what the top ailments are, chronic diseases, diabetes, heart disease, things that affect gen pop, but it may be specific, other issues that you encounter. Additionally, they talk about if there is any substance abuse in the area, they'll mention that. Any mitigation efforts that have occurred, maybe they've had some success that might be bolstered by broadband adoption and usage, or maybe they've completely failed in broadband usage and adoption would help. You can do mental health counseling over telehealth visits. It provides a great deal of connectivity in terms of accessing specialized care, or even additional primary care physicians, if you have a significant shortage of those.
So, Andrew, we had a question actually from Rick Noonan. What encompasses the definition of telehealth? And what I would say is that they are very broad, just like every other criteria in this application. But in general terms, you're talking about anything from telehealth visits over the phone, telemedicine visits using tablets and video capabilities, so you can see and hear the provider and doctor and physicians and medical assistants, and remote patient monitoring, and just any and everything you can think of that needs network access, needs to be connected to the internet to connect you to a provider or doctor. And we're going to go into that a little bit more too. The other thing I don't want to forget to say is regarding economic development and job placement and workforce development. We're seeing at a lot of tribes that using simulators, getting simulators to learn how to drive a car, learn how to fly a plane, learn how to operate heavy equipment is a very big need, and all of those need to be connected online to the training materials that help them through those simulators to learn how to do those skills. So there's a lot of those things going on in a lot of tribal organizations that I work with. So all of that is covered or coverable. All of those expenses associated with anything we've been mentioning can be covered.
And I'll just add one more quick point on the telehealth definitions there. Again, yeah, it is, I agree with you, it's very broad. And that can be very specific to the individual. So again, with that remote patient monitoring, it could be a glucometer, a pulse oximeter, all these Bluetooth enabled devices that can share information immediately to the provider, so they can monitor your health from abroad and intervene before you have to go into the ER. It can also be for things like, let's say you guys have an anchor institution like a community center where you can hold public health classes. So, 150 people can attend if they want to, and you can teach people about the spread of COVID, or you can talk about, public health issues in the community.
Diabetes.
They're very specific to the individual or very broad to the community.
Mm-hmm.
And so lastly, the point I wanted to make there is that all these different public information sources, there may be a lot of the narrative already created for you. You just have to read and inform yourself about, again, with the public information like community health needs assessment, a lot of your telehealth needs will already be explained in there. For greatschools.org, you may have to do a little bit of additional research, but you can objectively state the performance of your schools and what might make them better. So there are a lot of public information resources for you.
So what you're saying is it kind of makes it easy because it's almost already written for you.
Right. Right, exactly.
That's fantastic.
And I'll probably add one more thing there that I haven't thought to really kind of state in a webinar before, is that a lot of the publishers for that information may be accessible for letters of support and additional guidance.
Yeah, I think the key messaging here is that you've got us, you've got other organizations, and you've got the NTIA who all want this to be a success and need to get this funding out more so than ever before. This is unlike any program ever in that they're completely dedicated to getting this money into your hands for the things that you need.
So moving on to the digital equity use cases, because I think broadband infrastructure is probably going to be a little bit more of a subject to tackle. You know, again, we'll probably be doing several of these webinars and developing templates for that. The distance learning, telehealth, and telework use cases are very approachable, and I think might get the wheels turning for anyone who's kind of on the fence on applying. So looking at distance learning here, we're going to be enabling distance learning capabilities at both the school and the student's remote learning environment. So that can be developing classroom solutions that allow the teacher to really kind of make use of the space as opposed to sitting in front of a laptop. They're able to use the whiteboards behind them to have kind of props and tools to, again, just kind of engage the viewer a little bit more immersively as opposed to, again, just kind of sitting in front, maybe doing some slides. You're kind of bringing them back into the classroom virtually as opposed to having these kind of webinar style interactions. So again, you're just creating a more immersive and engaging space there. For the remote learning environments, you're developing distance learning packages. We had a lot of comments from people who were trying to learn from home, or parents who are mentioning their students are trying to learn from home. Maybe they have 4 or 5 kids. They're all trying to learn from their laptops, but they can each hear what each other's classes are saying in the background. Or maybe there's some kids who aren't yet in school, running around screaming and stuff like that. You really want to make sure that they have a unique and kind of immersive learning setting for themselves, where you can include something like a laptop, and then more importantly, probably a headset, so they can be again, just kind of fully tuned into their classroom without distraction externally, along with the Zoom licenses or other types of video software that might enable them to connect to the classroom. So this creates a 100% intuitive and seamless solution to use, so it's not hard to set up, and again, it can just immediately connect into the classroom. So this would essentially remove barriers to access that are key for engagement. And again, just looking at the headsets is a real key asset here, enabling learning in noisy environments like a crowded home. One particular use case that I was attached to, that I had assisted this tribe in Washington with, they were looking at limited broadband availability in their area, and the interim solution was to print homework packets. So the metrics that they had shared were that only 60% of the packets were actually picked up from the school, and only 30% were completed and returned. And if you can think about what that does to impact the learning loss, it's almost like 2/3 of the student population fell behind, almost a grade level, from the 2020 year. So that tribe has since applied to purchase similar packages to what has been explained above for, again, not only the classrooms, but for students' homes, and enabling the synchronous and asynchronous learning so that they can access that learning, if for some reason they're out sick, if there's a snow day, if they need to help with a family business or something like that, they can kind of learn at any point, and again, access the teachers and professionals that can help them gain back some of that learning loss and continue to excel in the classroom. So looking at telehealth, we've already discussed most of the use cases here. For remote patient monitoring, chronic conditions, you can monitor diabetics, heart disease patients, people who have issues with medication adherence like Alzheimer's or Parkinson's, where again, if they forget their medication or don't keep up with their health, it can cause pretty drastic circumstances and high cost not only for themselves but for the local health clinic, with readmissions, emergency room visits, obviously more expensive than kind of a standard primary care visit. So you're looking at the benefits there. You can also use this to have telehealth visits for the worried well. And what I mean by worried well is individuals who may think they have an ailment, but upon engaging in one of these telehealth visits, can be assessed and diverted from the emergency room and either schedule a regular primary care visit or entirely avoid the healthcare system if it's deemed that they don't need to come in for a visit. For COVID positive patients, again, with the Delta variant becoming more of an issue every day now, you can look at giving proper protocols ahead of a visit. That way they don't just walk directly into the ER, potentially spread COVID around the ER for non-COVID positive patients. So it gives them a way to access healthcare, again, using the proper protocols and avoiding spread. Looking at mental health visits, there might be some stigma in the community for accessing mental health, or it may just be completely unobtainable in your area. Again, telehealth is a great way to mitigate that issue. Medication-assisted treatment for anyone suffering from alcohol or substance abuse. That can be administered in combination with telehealth and a mail order pharmacy now. So looking at a small village, or for the use case, a small village located on an island. Again, this is in Washington State, where I'm from, so it's kind of easy to come up with these use cases here. Residents were forced to travel upwards of 3 hours each way to access any sort of mental health service. They were able to access primary care, but that only goes so far. The local residents were also hesitant to seek mental health because everyone in a small town knows each other. They were worried about, again, the stigma of seeking that mental health service. So the solution here was that the local clinic set up this telehealth capability, and they were able to use the same office as the regular health clinic. So really, it kind of created an anonymous situation. People don't know what you're going in for. It could be physical health, it could be mental health, but it kind of removes that hesitancy to visit, a mental health specific building or to travel off island for it. So the accessibility improved health metrics on the island by reducing healthcare avoidance and improving the adherence to regular checkups and medication regimens.
As you're moving through this, I just had a thought. We've worked with tribal organizations and communities where, as you mentioned, the stigma can sometimes be a problem. People don't seek help. What we've seen in some cases is they put a private room in a facility like a library or a small building or the health clinic, but in places where people can go for whatever they may need and have access to a computer, whether they're just surfing the web or doing a virtual visit, a virtual field trip to a museum, or studying or connecting to behavioral health and counseling services. If they're in a private room, if there's a private enclosed area, that's seen a much higher success rate because people are, able to be completely private about whatever their needs are. So just a thought.
Fantastic. Yeah, thank you for that. I think moving into this last digital equity use case slide, all these are pretty straightforward. You can think about telework in the same way that you think about distance learning, expanding the network, technology for home usage, and potentially that connectivity experience for people who might be in the office, connecting to people who are working remotely. Looking at cybersecurity, I'm sure all of you have seen at least one article this year or last for ransomware and its impact on your business or the community. That happened with the gas shortage in North Carolina when that oil pipeline was kind of shut down with ransomware. Many universities and schools have been shut down and charged upwards of like $2-3 million to receive their networks back to them. So cybersecurity can definitely be included in here, especially if your tribe wants to set up their own internet service provider, retail provider. But it can be a part of these tablets, laptops, and stuff that you choose. Let's say like a McAfee or a Norton or whatever type of cybersecurity that you wish to include. That's worthwhile to consider. It can also be for network security. So they're bits of equipment that can help you determine the access of certain types of equipment. I've heard recently a use case where a casino was hacked through a fish tank thermometer,
Mm-hmm.
and they didn't realize it for about 7 months. And so
Mm-hmm.
all of their information was exposed. I think they, again, were kind of, they lost a bit of money in that exchange as well.
Mm-hmm.
So there are cybersecurity components that deem certain types of accesses to the equipment and technology used for everyday uses. And that kind of translates over to this Internet of Things capability as well. You can start thinking about this big picture in terms of being able to access, internet from anywhere on the reservation, from any device. You can learn while you're in the park. You can do telework while you're traveling around on a bus. The business capabilities are kind of limitless here. And then you can also add this portion of public safety, where again, we had a use case where let's say a police officer was attacked in a very poorly connected area for not only cell service, radio coverage, or internet. And so the idea here is to create this connected reservation where Wi-Fi access would be available throughout the reservation boundaries, so that public safety can kind of align not only for immediate connectivity for distress calls, but to connect, let's say, the closest ambulance with the person in distress calling from a cell phone, or to connect with like a ferry dock to prioritize the ambulance getting on board and traveling over to an island if they need to do so.
If I could add to, we've had a couple of questions. So there was a question about what about HIPAA and encryption as it pertains to telehealth. All of the equipment and technology that Andrew and I are talking about today and recommending comes with both high-level encryption as well as being HIPAA compliant. And I would just go one step further and add that cybersecurity. We're looking, when we talk about these things, we try to promote each of those levels of protection. And so it is all the equipment and solutions. You definitely want to reference that in your application, that you want to maintain HIPAA compliancy, and you want to reference the fact that you're looking for encryption capabilities, H.264 encryption, and other capabilities within the technology. And this again is places where myself and Andrew and all the other folks we have available to us to help you, we can go through that conversation and provide the spec sheets and the specifications that will reiterate that that's covered.
And I would think, if you're worried whatsoever on the HIPAA compliance side of things as you're developing these applications, certainly bring in your healthcare clinic, a point of contact from there to get their input. They're also going to be able to provide great perspective on what the needs are for broadband connectivity and these additional pieces of equipment and technology that are needed to improve health. But they'll have that HIPAA compliance in mind the entire time, because that's what they're trained to do.
Yeah, and I do a lot of work in the state of Alaska. I don't think we have anyone on today from the state of Alaska, but because they have exceptionally rural areas with lack of medical professionals, they use health aides in the region, and health aides have sort of a minimal level of education and information. And so, I want to translate that in the idea in the lower 48 for any of you that are connected. If you don't have all of these resources, again, this program is the way to help you get access to those and sort of virtually bringing them into your community. And we have a number of programs that help train and support on each of these levels, whether it's workforce development, distance learning, post-secondary education, dual enrollment, all of these conversations that Andrew's been mentioning. We have resources, tools, workbooks, templates, all sorts of detail on not only how to use that, but how to implement it, how to even think about getting it implemented in the first place. What are the steps you have to take to start to deploy something like that? So we have a lot of kits and details we can provide to help you with each of those steps, so you don't have to reinvent the wheel.
All right, so we're at our final slide before Q&A session. One of the things that we had heard from the program director is really, again, just throw the kitchen sink at this grant. So, apply for what you need and dream big for this, because, it's kind of a once in a lifetime opportunity. I mean, we've never seen it before. I can't say that we won't ever see it again. But it's certainly worthwhile to approach this as, what would make our solution, with these funds, how would it future-proof, our needs for broadband in the future? My suggestion, at a minimum, just apply. The worst outcome is $500,000, and I don't feel like I can say that enough times. And then lastly, we're looking at creating some templates, because we have heard some remarks that there wasn't a lot of information made available for guidance through the NTIA. Again, I think they're dealing with a lot of money, the creation of a new program, entirely from scratch, and they had 3 of them to do, with the general infrastructure, this tribal grant, and then the connecting minority communities. I don't know if they had a lot of time to consider, the templating. So for things like tribal resolutions, we intend to create one of those and just provide it as a simple guide. I don't think that they're looking for anything overly wordy. I think they just want to make sure that either the federally recognized tribe is applying, or that the organization is applying is deemed as the sole applicant that's eligible to apply on behalf of the federally recognized tribe. For templates on the narrative, we can absolutely create, some suggestions of how to organize your narrative. Maybe a couple of suggestions on how many sentences to provide here and there, where to get your information, like I was recommending with the greatschools.org. There's countyhealthrankings.org, the community health needs assessments for your county or counties. We can provide all these templates to really kind of guide you along the process. While we can't, specifically write the grant for you 100%, we can hopefully provide you with the direction you need to at least submit a minimally viable application that, again, at worst, will get you $500,000 for your tribe.
Absolutely.
So with
So
that,
what I would do is I'm going to summarize this and say that the difference between us and the NTI webinars and as a resource, we're going to give you sort of a menu of things that you can consider. So if you're looking on the network side in the broadband infrastructure, routers, switches, referring you to folks that have the ability to provide the fiber, the networking cables, all of those things that you need. If it's the application, the use case, distance learning, it's computers, laptops, desktops, scopes, peripherals, remote patient monitoring devices, cameras, of course, microphones, headsets, all of this technology. If it's telemedicine, I mentioned a couple of scopes like otoscopes, ophthalmoscopes, EKG, ECG systems, all of that, interactive displays that you need, even if you need those in the home, in the residence. This is all eligible because it will help move you steps further to increase that access to education material, increase your access to healthcare providers, increase your access to just basic information for workforce development and economic growth and job creation, and also just for mental health, behavioral health support, and general community announcements and community information. I mean, you could even have streaming devices and I'm trying to think of not video walls, but displays that provide wayfinding in emergency situations. And so the sky is the limit, and really someone earlier told me, Stephanie on my team said, the sky is not even the limit. You can go beyond, you can go into space, because every time that we've talked with the program manager, that's what they're saying. You need to go ahead and request whatever it is you ever thought you might need and see if you can get that in there. And so to open it up for questions, please continue typing those. I believe there's one, someone asked, where can we get the application guide? Stephanie, can you post that in the chat so everyone will see that link, and we'll also send it out to you. We are also going to be sending you some short video clips on how to apply section by section so that you can address each of the sections of your application. There was another question about registrations. What registrations do you need? You need your sam.gov, your grants.gov, and you probably, if you aren't the person who knows where that is, there's someone in the organization that already has that set up. So that is your homework to figure out who within the tribal organization manages federal programs and grants, because you could also talk to us. We can look up at grants.gov, sam.gov, and see if we can find your registration. So we can help with that. And the way to contact us is through Annalise. I wonder if you can put our grant email address in the chat. And you can also find, of course, Polly at polly.com. Andrew, do you have your email address or any other websites in this presentation?
I did, it's the one thing I did not throw into this slide deck. I apologize. I'll send it over to Annalise for her to kind of throw into the chat there.
Okay. Well,
a follow-up, sorry to interrupt, this is Annalise. A follow-up email is going to be sent out to all of the attendees today that has contact information for the presenters that was preloaded.
Okay, that's great. And just to reiterate, so my team has 6-7 people. Andrew's team has that and more. We've got people waiting almost like your help desk to help you through every question you might have, regardless of what it is. So please feel free to engage with us, and we are happy to get involved. What we typically do is set up a weekly call with everyone to who intends to apply, to help them get organized and follow step by step what they need to do by the September 1st deadline to apply. Any final questions before we let you go and have the rest of your day back? Okay, well, Andrew and I both thank you all for attending. We appreciate your attention and dedicating the time to this. Just consider us a resource and a help to you at no cost. Neither of our organizations charge you anything for using us to help you get this done, because our goal is grant advocacy and to help you achieve your goals. So we appreciate your time. Thank you very much. Look in your emails for follow-up information and a copy of a recording for this webinar. All right, have a great day. Thank you.